Alright, here's the situation. Cece, a new graduate nurse in the emergency room, needs to take a blood pressure on a pediatric patient. I will be serving as her preceptor and teaching her how to work with pediatric patients. First of all, it is important to provide a safe environment for the patient. You typically want to avoid busy, loud areas. We will put our pediatric patient in this fun, child-friendly room. Parents are also an important part of the pediatric pain management. During interventions, we're going to have the parent actually stay with the patient. When dealing with pediatric patients, it is important to understand which teaching learning strategies work for different age groups. Using imagery typically works best with school-age children. So let's say little Jessie here is 6. Jessie had a really bad experience at her last doctor's visit, so Jessie's very scared. Jessie needs her blood pressure taken. Let's first discuss the wrong way to go about taking Jessie's blood pressure. Hi Jessie, we need to get your blood pressure. I'm gonna put this on your arm, and it's gonna squeeze your arm, okay?
It hurts.
When school-age children hear the word squeeze, they may think the worst, such as this image. Now I'm going to show Cece the correct way to take a blood pressure on a pediatric patient. Alright, first I'm going to sit down. It's important to talk eye level with these children. It just creates a more non-threatening environment. It makes me as tall as you, essentially. Hi Jessie, I'm Sarah. I'm going to have to take your blood pressure today, and I'm going to need your arm, and this little device here is just going to give your arm a little hug. Which arm would you like to use? This one? Is this one okay?
Yes.
Okay. So when Jessie hears the word hug, she may think of this image instead of the other one. A much more peaceful image. Now we know how to approach a pediatric patient and perform a non-invasive procedure. Invasive procedures, such as starting IVs, require much more skill, patience, and a heavier use of imagery. So Jessie, we are going to need to give you some medicine to help you feel better.
Okay.
It's going to go in your arm through a little straw. When we put this straw in your arm, it's going to pinch a little.
Okay.
We're going to use imagery here to take Jessie's mind off the upcoming procedure. In imagery, the child is actively involved in visualizing a situation. Jessie, I want you to think about your favorite place in the whole wide world.
The ice cream shop.
That's a good place. All right, so you're at the ice cream shop with your mom. Is it cold or warm?
Cold, and it smells really sweet.
Ooh, I bet it does. What flavor do you think you're going to get?
Mint chocolate chip.
Yum. Maybe once you're feeling better, Mom can take you to the ice cream shop.
Yes, Mom, let's go.
This is an example of using imagery to decrease the patient's anxiety level prior to the procedure. After the child is relaxed, performing the actual procedure will be much more straightforward. The nurse will be involving the child in the procedure, for example, allowing the child to choose which arm to put the IV in, and going step by step in a language that they can most importantly understand. So Cece, do you have any questions?
No, but I feel like I've developed a better understanding for pediatric patients and won't be as nervous when I work with them. I will also apply imagery when working with the pediatric patients in the future.
All right.